Thank you so much for all of your feedback that you gave me with my Edit 8190 Artifact 5-minute presentation. Here is the updated and final presentation of my Edit Artifact. My name is Trina Gatson. And so initially, one area that I was interested in was SLP burnout, quality of life, professionals and student clinicians, and client caregivers, and how quality of life impacted all of these things. I had a good bit of trouble and confusion with what exactly I wanted to do and what made sense. And so some of the things that you saw initially, as far as artifact ideas, was community resource literature, an aphasia blog for speech language pathologists, and how to prevent SLP burnout. And I even threw out an idea as far as using Qualtrics. This made me more frustrated, and I found that the more trouble I had, I had to go back to what meant something to me as a clinical researcher and um, what the overall point of the assignment was. And so when I thought about those things, it took me back to quality of life being the top layer it all with it all boiling down to what was going on with clients and how the student clinicians and professionals had a role in that, and how skilled intervention providing therapy had a role in that. And so with that idea in mind, I became very excited and knew that I wanted to continue on the path of looking at quality of life and what role I played as a clinical researcher, but also what my colleagues knew about quality of life. And I had an IRB that was improved. I have an IRB that is approved looking at health related quality of life in people with aphasia, with my mentor, Dr. Rebecca Schisler Marshall. And so I figured that this artifact needed to include that. And so I want to talk to you a little bit about what this approved IRB is, and that way you can get a better idea as far as why I chose the artifact that I chose. And so what I'll be doing is looking at health related quality of life as part of a regular clinical protocol in the speech and hearing clinic here on campus at the University of Georgia. And so people with aphasia, or clients in general, when they come into our clinic, we give them a battery of assessments, and normally these assessments didn't include quality of life indicators. And as more research is produced showing the importance of quality of life, we are now providing quality of life assessments as part of our regular clinical practice. And the procedures involved as part of my IRB is literally just collecting that data pre and post treatment. And so clients will be assessed with their quality of life prior to treatment, and then reassess after treatment. And one of the questions that I have is, does quality of life improve as a result of treatment? Here's a little bit of information as far as the data analysis for this project. One thing, again, just looking at the relationship between language communication and how people perceive their quality of life, possibly using multiple ANOVAs to determine any impact. And so I'm excited now. I'm excited because I have a good artifact that I think will not only benefit the body of literature and what I'm doing with this approved IRB, but also give me more insight on where the breakdown is and why speech language pathologists may not be considering quality of life with their clients. And so I wanted to get into a little bit of what my survey is. I have already completed the Qualtrics survey, and this is question number 1. I want to know what the primary setting of practice is for these individuals, because I know that depending on what setting they're in, that might be a determining factor on their ability to assess quality of life. questions 2 and 3 are here. I want to know how often they use the following assessments: language assessments, cognitive assessments, quality of life assessments, and motor speech assessments. If you can tell, I've already started to fill this survey out, and so the responses that you see are my responses. And for the individuals that do use quality of life assessments, I want to know which ones they're using. And so these quality of life assessments that I've listed are the most popular within our field, as well as assessments that I used in my summer research of looking at quality of life within an intensive treatment program. My next questions, I wanted individuals, the speech language pathologists or student clinicians, to rank their quality of life assessments that they use, and here is my ranking of them. If you notice, I don't use any quality of life assessments because that could also be what's going on right now and where education would need to take place if there are individuals that don't use these quality of life assessments. And then I also wanted a, more personal answer as far as, do you think quality of life is important to assess as part of treatment? Why or why not? And I have filled in my response to that. Of course, I think that quality of life is important because I recognize the challenges that communication and emotional impairments um, um, have on an individual and how they are able to contribute to rehabilitation. And so I'm interested to see what my colleagues are putting in that box as well. Finally, I wanted to know what additional resource and or treatment material would best benefit people with aphasia. And so if you notice at the top, this question here, what I did was bring some of those artifacts that I originally thought might be beneficial to use and put them here to see if they are beneficial, but to get more of a survey, more of an opinion on those from my colleagues. And then I wanted to know how my colleagues were rating their own quality of life as a speech language pathologist. Do they feel like it's good, worse? And depending on those responses, I will definitely look forward to getting more information as far as what could be negative indicators to quality of life indicators in speech language pathologists. And lastly, I wanted to know, do you believe that healthcare professionals should assess quality of life indicators as part of regular clinical practice? And so one of the things that I feel like this survey does is look at not only the knowledge that's already out there with quality of life use as part of assessments, but also gives me a good idea of where I need to go as a researcher. And here's the link to my Qualtrics survey. If any of you are interested in getting a up close personal look at it, here it is for you. And I am again really excited about where I ended with this edit artifact. And although it does not specifically relate to my approved research project, it does relate to what needs to be done from a speech language pathologist standpoint in looking at quality of life, but most importantly, implementing quality of life assessment measures in the clinic. Thank you so much. I look forward to your feedback and happy researching and artifact creation.